right, you're watching the AM show, and we're coming to the COVID conversation that I mentioned earlier. So in the last few days, we've seen a decline in the number of active cases that we have in Ghana. But there are concerns that no, yes, the active cases may be declining, but the number of deaths that we're recording are still going up. So it's very important that people continue to take care of themselves. So though the decline in active cases may give us some comfort, we shouldn't. We're not out of the woods yet, and so we shouldn't take things for granted. Fortunately, we have an inoculation program, or the Ghana Health Service has resumed the rollout of the vaccines, and so we're encouraging people as much as possible to go for it. So let's get to the dashboard right now. As you can see it, we have 522 new cases. There are 930 deaths and 6,004 active cases. I want to just get you to appreciate why I say there's been a decline in our active cases. And decline in active cases does not mean that we don't have any more COVID cases, because on a daily basis, we're recording a good number of cases.
New symptomatic cases.
Yes. All right, so let's get to the previous updates and go to August 5. If we go to August 5, so sometime last week I went through, I did this. We go to August 5 where we had 6,000, almost 7,000 cases.
Yeah.
And that appears to be
6,940 something.
69, yeah. And that was, I think, would be the highest point we got in our active cases. It's been declining subsequently.
For this third wave?
For this third wave.
Yes.
It's been declining subsequently. And we're taking a good look at the figures from the trend that we've seen since COVID happened. We've seen that when we peak and the cases begin to decline, then we're probably going to decline like that, and then people relax.
And then it picks up again.
It picks up again. So we need to be really careful. So yes, the number of active cases may be declining, but yes, we still need to observe the protocols. The mask is the most important thing. But yes, let's get into the conversation, and we're bringing on board some of the experts, and they're going to be telling us what's actually happening as far as our COVID cases are concerned, and what we're to make of the figures or the stats that we're seeing from the Ghana Health Service. So we'll get into that conversation. And one of the people we're having joining us is Dr. Michael Owusu. He's a virologist at KCCR. And then we have Dr. Fred Adomako Boateng of the Bono East. He's a Bono East Director of Health at the Ghana Health Service. So there, let's go to August 5. So you see the August 5 figure, 6,969. And then we move to August 6. On August 6, you see that there's been a decline. So August 5 was the highest number, or highest number recorded in this third wave. So from August 5, we go to August 6, and then August 7, and you see the indicators as we have it. All right, but let's get into the conversation. All right, so let's get on to Zoom now and get to speak with the experts that we have gathered and get to understand what the figures are looking like and what we're to make of the figures. We have Dr. Fred Adomako Boateng, the Bono East Director of Health, and Dr. Michael Owusu of KCCR. Thank you both for joining us for this conversation. And so I am looking at the figures, and it is safe to say that we've hit our peak, and we're going to see a decline, or going to continue to see a decline in our active cases. I'll start with you, Dr. Michael Owusu.
Morning to you, and good morning to Dr. Fred Adumako as well, and then to all your viewers. So indeed, I've also been studying the numbers being churned out by the Ghana Health Service, and also within my own center, I've also been monitoring the number of new cases that we keep recording, both among the travelers, the population of travelers who are mainly asymptomatic, who are not sick, and also those from the community, who come in from various health facilities, and to see how the numbers are playing out. So if you look at, the national data, although the active case count is one of the indicators that, you use to measure where you are getting to in terms of, the epidemic wave. For me, the number of new cases that you get reflects how well you are doing in controlling this. What we have seen about this Delta variant is that people are able to keep the virus for a long number of days, unlike what we used to have for Alpha. So, people get sick today, you retest them in 14 days, they are likely to still be positive, and they will continue to about 21 days. So, of course, you will still expect that the active case count will be quite, the number will go up because it takes some time before they go out of that window period. But if you have looked at the number of new cases, since we entered into this third wave, you realize it's rising. And if I get it right, I think we now have about 522, yes, which seem to be, the highest so far that we have recorded. In the second wave, we did something around 700 before the cases, came down. So seeing 522 could be due to two main things. One could be a reflection of still a rising number of cases that we are seeing in the different regions, as you see from the dashboard. But it could also be an improvement in the data that is being churned out by the various labs. The Ghana Health Service has had difficulties in getting real-time data from various labs because of sometimes issues of how well the labs are able to respond when it comes to real-time submission of data. And I know they have been meeting the labs and have been encouraging them to submit their data on a daily basis. It is possible that what we are seeing could mean that the data being churned out by the labs is improving, which is why we are recording a number that is likely to reflect what we are seeing on the ground. So ideally, if you have 522 at this point, it tells you that we still are still accelerating. And it is possible we will go some number of weeks more before we can hit the top, and then we can begin to go down. So the number of new cases is a reflection of what we are seeing, which will mean that still there seems to be active transmission of this virus across various parts of the region. But then, for my center, for now, also have been monitoring for those who submit samples to our center. If you look at the traveler population, of course, the numbers seem to be going down. We used to record as much as 15 to 20% among asymptomatic cases.
All right.
But as now, number seem to be going somewhere around between 5 and 10%. So that's among asymptomatic carriers. It looks as if the incident cases, even for the community cases, where we used to have huge numbers, I got to a point where about 60 to 70% among all cases that present to us. The prevalence we are seeing now is not that high compared to what we used to record 2 to 3 weeks ago. It's a bit down, but then it's at random. Some places that samples come from, you see rapidly about 70% of the samples becoming positive, but other places you see numbers going down. If you want to make a meaning of this, you could also interpret it in terms of how people may be responding. The last time the president gave his address, I think it was somewhere on the 25th of July. I was expecting that by 8th of August, at least within 14 days, if people were to respond and adhere to the protocols, you would at least expect some reduction in the number of new cases as a measure of how well people are complying. but we are now doing something around 17th August, 3 weeks down the line. So, and I know some of the regions are enforcing protocols. I mean, police are ensuring that some parts of this country, people are doing what they're supposed to do. So it is possible for places that adherence is on the top, the cases are reducing, but then for other sites and places where people don't care much, cases are rising. So it is a bit at random, and it's not easy to tell whether we are really going down. But with respect to the regions, different places are presenting different numbers. And if we aggregate all of them, on the average, from our center, it looks as if things are getting back to, things are getting better. But as I said, it depends on the various places that the samples are coming from. So this is how I see the numbers. And I think that we still have some days to go before we can say we have hit the very top or the very peak. And the numbers are still going up. We have to be very careful and to encourage many people to still adhere to the protocols.
Now, I would want to come to you a bit later for you to explain to us, Dr. Michael Usu, how we reconcile the decline in active cases with the number of deaths that seem to be on the rise. But I would want to go to Dr. Adumako Boateng to find out from him what the situation is in his neck of the woods. So what's happening in Bono East? Is it reflective of the national situation?
Thank you, Israel. Good morning, my friend Michael. I think as Michael clearly stated that the national figure may be hiding some regional differences.
All right.
And which I will want to stick to. For example, if you look at Bono East, the first wave that we got, the highest number that we got for a week for positive cases was 173. And if you remember, the first week, in the initial stages, we are having challenges with testing so that you could have aggregate of results that were coming from different weeks. And with that challenge, the highest number of positive cases that were recorded in a week was 172. Fast forward to the third wave. For Bono East, for the first time during this pandemic, the 31st week, we recorded 220 positive cases. It's never happened before in Bono East.
Yeah, that's quite significant.
And for the last week, that is the 32nd week, we recorded 200 positive cases. So you can see that we actually are having a lot more cases in this wave as compared to the first wave. And even if you look at the national figure, though it's coming down for us, though we have moved from 220 to 200, for us, it's still a very huge number for Bono East. And I think I agree with Michael, as he said. For the figures that we always see, it's always the tip of the iceberg because we cannot really do extensive testing to pick all the realistic cases that we are having. But be as it is may, it shows that we are really doing well. So for Bono East, as we are speaking now, the total number of positive cases that we have is 322.
You mean active cases?
Active cases. We have never gotten anywhere near this number before.
What could be happening there? What could be accounting for that, though?
Yes, and that's where I will come in and then talk about what we are. So you can see that though nationally we are doing well, we have some regional differences. And the reason why this is happening is, when the seemingly silent that we had during May, June, that the highest number of cases that recorded was 6. And even at times, some weeks, 0. So people went to sleep.
All right.
And then the enforcement was thrown out of the way. So we saw that people really were not adhering. But this is where I will want to praise the regional minister and his team. Look, as we are speaking now, we have taken enforcement of the adherence to the safety protocols on the front burner.
All right.
And it will surprise you that even the regional minister is calling me Sundays, the regional commander himself is calling me Sundays and going from churches to churches, telling them of the measures that we have taken in place. if you look at Bono East, the drivers are really coming from only four sub districts. That is Techiman Municipal, the central part, and Kransan South, the central part, Kintampo, the central, the big town. These are the drivers of the transmission. But these are where that we have actually stepped up the enforcement activities. So Israel, if you come now, and I was so happy as I walked through the town, the way people are now adhering, the police, the visibility of the police and enforcing. So, and I'm happy that this is happening, not for the bad reasons, but the awareness that has come to people. And I strongly believe that the next week, next 2 weeks, as we have come down from 220 to 200, we are going to go down. But you also made a very important point. For Bono East, for this second, third week, we have gotten almost 33 deaths. For the first week, we got only 14 deaths for the first week. But for the second, for the wave that we are now in, we have gotten 33 deaths. And that speaks to the dilemma that we are in at the moment. And to add salt to injury, about 13 of the cases were recorded within 10 days.
Oh, wow.
So you can see the precarious nature that we are in. But I would say that with a drive from the RECSEC and the regional minister himself leading, and if this become part of a new normal, regardless of whatever we are going to face in the future, Bono East will be able to stand the test of time. And that also, I think you go there, has added more for people drive and waiting for the vaccines now. It's amazing people calling us when ours are coming. So in all, I think we are a lot of good lessons that we can learn from. And I believe that as the trajectory is going, Bono East is also going to go down. But we are still not out of the woods. And therefore, it's important that the measures that are put in place are adhered to. Thank you.
Well, that's great. I mean, I'm glad to hear that your region is doing something quite wonderful.
He did tell us, you know, we spoke to him last week, if you remember. And they did say that they were going to put all these measures in place. And Bono East was a hot spot. And he talks about the fact that, you know, there were there's a lot of traffic coming in and all of that. So it's good to know that later on maybe he can share with us some of the very practical steps that, you know, were taken, you know, what kind of punitive measures were put in place. Yeah. Is it just the police presence? You know, that is. Actually, let me just ask you, since you're on the line, is it just the police presence that's making a difference? Or are there like penalties and things in place? Because we spoke last week and we were not too clear on how we were going to achieve this, but you've obviously done a great job.
Okay, so thank you. So we have some measures that we put in place, which I'm going to discuss with you. Okay. The minister, Charles, you know, had a press conference and then listed all the measures that the RECSEC which was going to take, led by the security agencies. And some of the measures that we put in place was that, look, if you are really going to have any funeral, then it means that you will have to go by the protocol that has been listed by the president. You don't stay more than 2 hours. Okay. And that everybody should be in mask. And whenever we come to that gathering and we see that people are flouting the protocols, the people who are going to be held in charge are the organizers of the activity, period. Okay. So if we come to your church and we see that people are not adhering to the protocol, we make the management responsible for that. Okay. So that is any gathering, public gathering where we have 2 or more people, the organizers should make sure that they ensure that people adhere to that. And then secondly, what we also did was that together with the security, and that also translates to public transport and all those, Pragia and all those, when we finish, I'll show you some interesting pictures that we got when we were enforcing the law. That when we get you and we see that any of the passengers is not wearing a nose mask, the driver will be held responsible. I mean, we make sure that people were responsible for.
When you say held responsible,
yes.
What do you mean? Was there a fine? Was there, what does held responsible look like?
So one of them, which we some of them you don't want to put on the platform for, I mean, for people to, the police also ensure that if you are caught, in fact, when we were couching the communique for the president, we said the security agencies will support. They said no, they won't support. They will prosecute. Okay. So what they do is that when you are seen flouting the protocols, you are arrested. And those things I don't want to share. Where we will take you and the things that the statements that we will do. You know, we are doing all these that we will take you. Make sure then now and then, if you don't have mask, you buy one. If it's 10 cedis that you can't even get to buy. I mean, I think it's a punishment enough. Something which is being sold about 1 cedi, then you end up buying about 10, 15 minutes, which is unbudgeted for. I think these are things that you really feel when you are made to do. But some we are arrested and we organize some places that you have to go and stay for some. So we have done a lot of these issues. The minister himself engaged the traditional leaders into making sure that these are also enforced. Saturday, I went to a funeral in Kintampo. It was so wonderful. The way they stuck actually to the rules and then the nose mask. So it's a learning curve for us. And for me, we have been saying this is a new normal. If it's a new normal, then we should make sure it's assimilated in our lifestyle. Our way of life, because we don't know which other wave, whether gamma, epsilon, or whatever, which is going to come, which we will not have luxury in terms of what we are having these. So if this is really a new normal for us, then it's really good. But I think the security agencies are so interested. For us now, if we get our vaccines, do you know who we are going to give first? It's the security agencies. Of course. The way they have impressed us, the way they are going about enforcing and going all around, exposing themselves. So obviously, as we are going to get our consignment, that is our priority for. And all this is informed by these things that they are doing.
When are you expecting your first consignment of vaccines?
This week, actually, we will have ours this week.
So this week is, Wednesday, Thursday, Friday, Saturday. So
yes.
do you have a specific...
The program manager actually spoke to us at length yesterday night. So the moment I get it, I will let you know. But we are definitely going to get ours this week, and we are preparing. We know where we are deploying them. We know who is getting. So we are making ready for that. But I think when it's deployed for all the other regions, you hear it. But we are getting ours this week.
Okay. All right. Well, it looks like you're doing a really great job there. So well done. We're happy to hear that you have everything under control.
All right. We've also been joined by Professor Alfred Yorsing. He's a head community health. Thank you very much, Professor Yorsing. So I want to understand what you make of the stats that the Ghana Health Service has shared so far about the number of active cases we have and the deaths. Are you able to make any meaning of it?
Yes, obviously, this is quite basic. If at a point, not too many weeks ago, you are having active cases in the hundreds and death hovered around 700 for quite a time, and now you are having active cases in the thousands, and then death rates have increased from 700 to 900 within a space of few weeks, then it is clear that we are having a wave. So there is nothing scientific or complex about that. It is just practical, and we have to see it as such. If there are technical issues about the numbers and how accurate they are, yes, that is a different issue. But clearly, we are having rising in cases, rises in death rates, rises in hospitalization, and all that. And that is something we need to be wary of.
All right, there's no dispute about the fact that we are having a third wave. The issue I was pointing to is that we've seen in the last few days a decline in the active cases, but we're also seeing an increasing number of deaths, and that's quite worrying. I don't know if you have also observed that trend.
Yes. Unfortunately, we've been told by clinicians and those who take care of the ICUs, the intensive care, that when people contract this new variant, the Delta variant, all their clinical parameters are in the sky. Things that will, what we say, will portend unpleasant consequences. So it is clear that the current variant that we are experiencing creates more severe illness and critical cases. And we therefore will require a lot of bed space, a lot of human capital in terms of critical care. You know, we've been saying this since the beginning of the pandemic, and now it is really coming home to let us know the importance of putting in measures at this level. People may still be asymptomatic, people may still have mild to moderate illness, but the number of severe cases that we are having relative to the previous times, it's higher now. And therefore, it is clear we are having more critical cases. And once you begin to have such numbers, then death rate is certain to rise. Even as we are trying to contain the new cases, the fewer numbers who get the condition relatively, because they are having more severe illness, you will still find your death rate still being high.
Now, let me come to Dr. Michael Owusu. So the question I was asking to Professor Alfred, you're saying, is the same I'm putting to you. Have you been able to identify why, even though we're having a decline in active cases, we're getting a number of deaths, increasing number of deaths?
Well, I think that he's explained it partly because of this particular variant that we have. You know, this variant is about 70% highly transmissible than the Alpha variant. And because it's highly transmissible, what it means is that more people are infected. And if more people get infected, more people will get severely sick and more critical ailments. And therefore, you will expect more people to die. Ideally, the number of new cases should correlate with the number of active cases that we record. And this should also correlate with the number of deaths. But we have a limitation. You know that the deaths that we are seeing is not daily deaths. These are not new deaths that are being recorded because of perhaps challenges with getting the report from the various facilities to verify whether this is due to COVID or not COVID before the data will finally be put in the system. So it is possible that the deaths we are seeing are just cumulative numbers that will have happened sometimes a week or two ago before it's put in the system. So it is difficult to tell whether the deaths, why the deaths are going up, active cases are going down, because the deaths could have occurred a week or two or three before. Until you are able to record number of new deaths to match with number of new cases, a number of active case counts, it's difficult to really make a good meaning of these three numbers. So if you have to plot a graph of the number of new cases, number of active cases, and the number of deaths, you realize that all the three lines have to go together. And as active cases increase, you will expect deaths to increase, and number of new cases will also increase. If the new cases goes down, active cases will go down, and deaths will go down. So this is how I see it. But the point here is that because it's highly transmissible, a huge number of people are infected in the system, and people may just present to the hospital with low oxygen saturation, almost on the verge of dying. Others who have recovered may also have complications, things that are unusual because of this strain. And I think that it's partially why the deaths are increasing. The second wave, we have over 300 deaths. If things don't normalize and people don't respond well, and if you look at trend of data of the Delta, it is very possible you may exceed the number of deaths we got in the second wave because of the strength of this particular Delta variant. But if things are put in place, like Dr. Domako was saying, if every region is to act like how this region is working, then we have a chance of reducing and spreading this over time, and what people normally call flattening the curve, so that you can be able to soak the pressure and reduce these deaths and active cases and new cases, and you have an opportunity to be able to manage this very well. But for now, I think that things are not very, very smooth, and we still have to encourage that the public adhere to the protocols and do what they are supposed to do.
All right, now let's talk about vaccines. We have the Johnson & Johnson vaccines being rolled out right now. We had some 177,000 vaccines coming in. Accra is having its share. Kumasi is having, the Ashanti region is having its share. The Greater Accra region has also had its share. And we're learning that the Bunu East region will also be having some of those vaccines. What has been how are people taking it? Because in some breath, you hear people saying that they are eager to go for the vaccines, but then in another breath, you hear people spreading all these myths about blood clots and all of that. Can you address the issue of these myths? I'm sure you may have come across some of these myths, and if you can address them.
Yeah, so I think first of all, we need to commend the ministry, maybe government and other agencies, support partners as well for getting this for the country. I think it's very good for us at this critical period to have a single dose vaccine. One, because of the compliance rate. Before we had 2 doses, and it was a bit difficult that somebody will get the first dose and may not get second dose. There are many people who had the opportunity to take their first dose, but then they don't have the second dose. And having first dose will only make you partially immune, which will mean that you are still more susceptible compared to somebody who has taken the 2 doses. So that is one of the advantages of having a single dose, because once I take it, I don't have to come back. I mean, our center at KCCR is one of the centers in Oforiko that is vaccinating, and since they started last Saturday, I have looked at the numbers, and it's very encouraging. There are a huge number of people that are so eager and are willing to take the vaccine. And as of yesterday, they couldn't even contain the numbers and get to the afternoon. So the eagerness is there, and people are quite excited because people know that the vaccines are working. The other good thing is that, this vaccine has also some very good efficacy rates. We're looking at numbers like close to 90% efficacy against hospitalization and critical deaths. And then also after taking the vaccine, you expect that within 14 days, you should also have mounted the highest antibody titer level. So it's also one advantage that I also feel that if we are able to give this to many people as possible, we'll be able to reduce the impact of this third wave that we are having, which will mean that in 2 weeks' time, many more people are likely to attain the highest antibody titer, and therefore, in a month's time, we can already predict that we are likely to have a reduction in cases for some hotspots. Also remember that the vaccines are targeted at the hotspots, which is very good. So in Ashanti region, in Bono, in Greater Accra, which are driving the numbers, if you have more of them vaccinated, you have a chance of at least succeeding in reducing the active cases. In terms of the myths, we've had these myths since time immemorial, and it became much stronger during this COVID era with many stories that people churn out. And unfortunately, people churn out the stories when the vaccines come. When the vaccines are not there, people are crying that vaccines are not there. But as soon as the vaccines come, then they create the stories and put them around for other people to fall in the trap, which is very, very unfortunate. And which is why I think that we still need to engage the public through your airwaves and to ensure that people understand what they are dealing with. But while saying this, it's also good to be as transparent as possible with what the vaccine stands for. If you look at the Johnson & Johnson vaccine, it's not 100% safe. In terms of the safety information, there is some 0.2 or 5% chance that if you vaccinate a large number of people, people are likely to experience some unusual symptoms, of which People have recorded some blood clots and low platelet level. Some of them have seen blood vessels in the brain, lungs, and abdomen, which could have problems. And others have recorded shortness of breath, chest pains, and leg swelling, persistent abdominal pain, severe headache, and blurred vision associated with this. But if you take 1 million people, you expect just few numbers, sometimes in their 10s or 50s to do this.
So out of 1 million, you're saying out of 1 million, we're looking at maybe about 10 or 50?
Of course, I mean, something between 1 to 5% out of 1 million. These are numbers that others have seen and recorded. So it's very rare. It's unlikely. But the larger number, if you vaccinate large numbers, this is where you begin to see this. If it's just about 100,000, you may not see even this occur. So people must understand that, yeah, this is what it comes to. What it means is that once you take the vaccine, you still need to monitor, yourselves, either you yourself or health workers within 14 days to see whether you present with some unusual symptoms. And once you present with those symptoms, you have to quickly go to the hospital and let them assess you, check on you to see what they can do to, if you have any of these things that are likely to fall in those numbers, they can take care of you and manage you appropriately. And people have to just know that this is what happens when you take a vaccine. Not only COVID vaccine, but many other vaccines have some time of this occur. I took mine, AstraZeneca, I was fine. I know people who took it, and within about 3 days, they had to be hospitalized.
Yeah.
And they had to be given some infusions before they got better. Johnson & Johnson, I know people who have taken it, they are fine. Others took it, and then the next day they couldn't wake up. They had body pains, body weakness. Others said they have neck pains and all that. And this is what comes with it. So once we're able to track it and understand how to manage it, we can deal with it. So whilst communicating, this is good. 99%, you are sure that this is safe and can work for us. But there are cases where 1 or 2 or 3 people may have something that falls outside the normal range. And for such people, I think it's good to let them understand and know how best we can deal with it and handle it such that they don't experience any untoward events because of that. I know the FDA is working around this. And I also know that various clinicians are collecting data that they can help all of us to understand how this plays out in our region. I also understand that, a lot of the trials have been done in the Western world and also some part of South Africa and other few countries. As we give out these vaccines, we are also learning how it plays out within the African continent. And how we respond to vaccines is not exactly the same way somebody in the Western world will also respond. So we are all learning to know how we will respond. It can be better than the Western world, but it could also be that we may have some peculiar population characteristics that will go along our own vaccine. So this is what I think we have to let people know and understand, so that when 1 or 2 people experience this, they don't say that the whole thing is not good, but then we will be able to quickly respond, manage them well, and to get them through the system. These are a few comments that...
All right, Dr. Michael Usu, the adverse effects that you're talking about, for instance, the blood clots, has it ever been established that these people who had the blood clots, it was because of the vaccines they took?
Well, this is something that I believe the epidemiologists will have some good understanding of. Trying to understand what you mean by adverse drug events and also associated illness as a result of vaccine is not that easy. Ideally, you are supposed to measure if it's blood clot. You want to look at the baseline data. What is the prevalence or incidence of blood clots in the population in people who have not taken the vaccine? And then after taking the vaccine, what is the incidence of blood clot? You have to measure these two and extrapolate what we call the probability that somebody will experience this as a result of the vaccine. So most of the times, you don't want to come out and say that the vaccine is causing blood clots. You want to see these are things that people you are seeing as a result of those who have taken it. But to have a causality or to associate what we call a plausible biological cause to the vaccine, a lot has to be done. You need to collect data, be able to measure and look at the prevalence between these two before and after the vaccine, be able to document, take your clinical information to establish clearly, because people may have tendency of blood clot before taking the vaccine. It's also possible, those who are elderly. So to say that he had blood clot because of vaccine is not. But then if you are churning out, if you are giving out vaccine to large numbers and even experience some events as part of good standard practice, you record these events and you have to put them in as part of your drug research and let people understand, so that if it happens, you don't just say that you are not told, but it is something that will come out. So we don't have much information. More data is being gathered, and I think as we gather more data, we can be able to have an understanding of how this happens, and then we can be able to work at it. For now, I can't say it is because of the vaccine, because the data is limited. But I think after giving our large doses, clinically we can collect information and measure these rates and have some understanding of whether this is due to the vaccine or this is an unusual occurrence that is in the people even before they took the vaccine. This is what we're going to do.
Now, what I want us to talk about next has to do with the vaccine rollout and what is happening in Israel, where they're having an increasing number of cases, even though they're one of the countries that has done so well when it comes to vaccinations. But anyone has a question for you, Dr. Michael Osu.
Okay, so Dr. Osu, just to clarify for us, how long does this vaccine offer protection for?
Well, for data out there for AstraZeneca, for Johnson & Johnson, for Pfizer, people are looking at something between 6 months to 9 months for antibody titer level. This is why many countries are calling for booster doses, which the WHO is highly against, because if other countries don't have the vaccine, why do you call for booster? So it is possible that even for those of us who took the AstraZeneca 2 shots, if you are to measure our antibody titer level in 6 months after taking the second dose, you are likely to have a decline in the antibody titer. But as you can tell better maybe after 12 months. So if after 12 months you begin to experience a new wave among those who have taken the vaccine, it just tells you that the antibody level is going down, and therefore you may have to put in another vaccine to deal with it. This virus is going to behave like in the influenza virus, where you have antigen shifts and drifts, said that every year you have to introduce new influenza vaccines to cover the scope of changing mutations that come along with the virus. So it's not going to be different. And you know, coronavirus is about over 30,000 base pairs. That very, very long. And therefore, you can't stop mutations. Mutations will always occur. So if Delta variants come and you realize that they have reduced the neutralizing antibody level for those who take the vaccine, you must expand the scope of the vaccine to cover these changing variants. So I expect that in a year's time, we should have an upgraded versions of vaccine that should be covering mutations to go along. And it's possible that every year we may have to be taking booster doses that have much wider coverage, so that we'll be able to protect the population for a long period, like we are seeing for influenza. If we're also lucky, it may become like a seasonal flu. And as we speak now, there are 4 human coronaviruses that are seasonal. The 229E and the OC43, H21. We always see them 5% among children who experience respiratory illness. So it is possible that you may not need a booster, but then it may become like a seasonal flu where every year though people develop cold and people may have mild disease, some may be hospitalized, but then this should be minimal so that you may not need a population vaccination strategy to deal with it. So for now, I think 6 months to 9 months looks like what people are looking at. But then we need to study the data and to collect blood samples after 6 months and 9 months to measure before we can properly see how this will play out.
Okay. I was asking because as Ghanaians, we're quite used to having vaccines that are for a long time. So, you know, measles, BCG, they're lifelong vaccines. And so I spoke to a lot of people and I realized that people actually think that this gives you immunity for, pretty much life. But 6 to 9 months means that you really need to watch when you have the vaccine and when that time elapses, so that you know they are vulnerable again, or a lot more vulnerable to catching it.
You have to remember that this is one of the fastest strategy for producing vaccines. We talk about hepatitis vaccines and measles because they were produced for so many years ago. They went through the rigid clinical trials. Some of them, the trials took so many years before we came out to know that they can offer protection for 5 years, for 10 years, for 15 years. These are new vaccines in the system. So you can tell if you can protect you for 5 years after 5 years, not now.
Okay.
So nobody knows. Okay. They are all collecting data to understand what happens next.
Right, Dr. Owusu, just before I let you go, you mentioned that the Johnson & Johnson gives its efficacy is about 90%, but to critical care and hospitalization. So clarify once again for us and for our listeners that this vaccine does not actually prevent you completely from getting COVID, but when you do, or if you do, it lessens the symptoms.
Yeah, so let me just give, so what they have stated in their drug insert is that the efficacy after 14 days is 76.7%. And then after 28 days is 85.4%. So what this means is that, but this is against hospitalization and then severe disease or critical illness.
Okay.
For things like asymptomatic, is about just 66.9%. So it is possible that when you take the vaccine, like for AstraZeneca, you will not develop severe illness and you are not likely to die or you are not likely to be hospitalized. But you can be infected. I mean, you can be infected, you can transmit as well. Because transmission and infection is something that most of these vaccines are not so much stronger at doing. So the key outcome that has been measured and found to work well is against hospitalization and then critical illness and deaths. And this is what we all want. I mean, if I vaccinate and I get infected and it's only mild and I can do well, why not? I'll be very fine. But then if I vaccinate and I still develop severe disease and then I'm in critical illness, then that is a problem. But the vaccines are working well when you talk about hospitalization and deaths. What it also means that even after taking the vaccine, people must understand that we still have to put on the mask because you can transmit to somebody who has not taken the vaccine and the person can be infected.
Yeah.
And the person can develop critical illness. So the people having in the mindset that they will take the vaccine and because of that they will take off their mask and jubilate around and play around, it's not very safe for us.
Okay.
Population-wise, we are looking at 30 million people and we only have about 100,000 doses. We've done about close to 1 million. It's woefully inadequate. And you have a large number of people who are still susceptible. Very huge numbers are susceptible. And those who are vaccinated can still become reservoirs for infecting the many susceptible populations that are around if they don't mask up. And this can contribute to further waves that will come. So until you hit your 70% herd immunity, this is where you can take off your mask and go to your stadiums and play around. But for now, you cannot advise that people should take vaccines and just do what they are doing. They will just put that people's life at risk.
All right,
sure.
Okay, all right.
All right, I want to bring in Professor Alfred Yossing and Dr. Adumaku Boateng on the conversation about vaccines and the myths. Prof, do you have any thoughts to share as far as these myths on vaccines are concerned?
Yes, as the previous speaker said, these myths have been with us since we started a vaccination program in Ghana somewhere in the 1978. And for every child, before the child is a year old, they take about 13 different antigens. And these are things that we've been doing over years, 40 years plus. So we need to get the public to be confident that these myths only come about whenever we are going to introduce new vaccines. It came when we were introducing the malaria vaccine. It came when we were introducing the meningitis A vaccine. Every time the program wants to introduce a new vaccine, these things come up. And at the end of the day, all the myths about men being impotent, women being infertile, and wanting to curtail the progression of our generation. We've been vaccinating for 40 years. Our men are still potent. Our women are still giving birth. So some of these things, we should treat it as myth, as you rightly call it, and then look at the benefit of the process, as we have said. If it is going to protect a large number of our population from getting severely sick and preventing death, I must emphasize that data from the treatment centers, irrespective of time, as to whether data has been captured in real time or not, we have seen clinicians have seen death rate increasing. In Kolebu, we see it, in East, we see it, and we see that the Delta variant compared to the previous Alpha 1, the death rate are not the same, regardless of the time space you look at it. And that is why we need to educate the public. We have nurses, we have doctors who go to work, and by the time they come home, the number of mortalities they have experienced, and these are real life situations, and they tell you, and you know that these are not the usual things we used to see. So we need to get the public to understand that this particular variant we are experiencing is taking a huge toll on persons who are getting critically ill and needing care. And therefore, despite the myth, as we say, COVID waits for no man. If you have opportunity to vaccinate, it is important to vaccinate. We've seen that those who have vaccinated relatively, if you look at the critically ill and the persons who are passing, you see that the toll is higher in those who have not been vaccinated, and then relatively lower for those who have got only one vaccine, and then for those who have had the double vaccine. These are data we need to look at carefully and then put it out there for people to know. But we know this as clinicians, as persons who take care of these critically ill, that the cases are getting more severe, and we need to, as Dr. Adumako said, if all regional directorates will put in such measures, these are important. Whether it is Alpha, whether it's Delta, whether it's Zeta, the same primary public prevention measures will work. The biologics and the science is important, but the public health measures are critically important. If people should continue to wear the mask, if people should continue to maintain social distances, if people should continue to prevent mass gathering, these are things that will help us, especially for a large vulnerable population like ours. So we need to continue in the midst of the vaccination conversation, still insist and let Ghanaians know, especially getting to the season of festivals. We are in August, September, and these are where a lot of festivals are held. We need to continue to educate the public that regardless of your immunization status, as was rightly said, you can still get infected, you can still transmit to others. The fact that you've been vaccinated does not prevent you completely from getting the infection. And therefore, you might still transmit it to others. You may have been protected, but others may not be so fortunate. So we need to continue the conversation on the primary preventive measures. The hand washing, the mask wearing, the social distancing, these are key. We shouldn't lose sight of in the context of the vaccination rollout.
All right. Now, I can't end this conversation without bringing up this issue, which has been there for, since COVID happened. It's about the fact that Africa, or let's take the case of West Africa and maybe Ghana in particular, we haven't really been hit as hard as other countries as far as COVID-19 is concerned. And I'm talking about the Western countries. So Ghana, yes, we haven't had so many vaccines, but if you look at what is happening in other countries, and I'm talking about Israel, where about 78% of people 12 years and older they've been fully vaccinated. And yet, if you look at their stats, as we have it right now, they've had a total of 951,000 cases. And they have a population a lot less than we have. They have the new cases of 1,691, total deaths 6,694, and their new deaths are 7. So this 7 new deaths is happening in a day. If you shift to the end of the table, you see that the population of Israel is somewhere just about 10 million. And they're having this kind of impact from COVID-19. What is it that is going wrong in Israel? And what is it that is happening in our favor here in Ghana? And I'll put that to you, Dr. Michael Owusu, as your final comments.
Well, it's quite interesting. And I believe that those of us in research and epidemiology and public health will need to look at the numbers and see what is playing out. Like you said, I've also been wondering. I was so much afraid of the Delta variant because of what I saw out there in India. And when we first recorded 2 cases at the airports, I was so scared that if this enters Ghana, how would it be? But to tell you the truth, what we're experiencing now is not something that we want to say it is the Delta. But the Delta that we have seen elsewhere is so serious. So there are some factors.
So you're thinking it's not Delta, maybe another watered down version of Delta?
Exactly. There are some factors that seem to protect us that is unexplained. That I sometimes don't understand. I did a lot of work in coronaviruses. I know that even before the SARS-CoV-2 came, we measured antibody titer levels against the other form of coronavirus. And even before that, 70% of Ghanaians had antibody to the various species of coronaviruses. And we are thinking that it could be that we have some cross-protective immunity against some of these, that it limits the impact of it. Because, I mean, you go to a school where a number of people have the Delta variant, like what we saw in Achimota, but they are fine. I mean, observing them, and they are playing out there, and you ask yourself, so did they really get Delta? So I think that is a question for researchers. I can't say it all, but I think we have to collect some data and know why, when these things hit our country, the impact is not like we see elsewhere. For reasons why, maybe Prof.
Let me put it to Prof. Prof, do you have any ideas?
I completely agree with Dr. Owusu. Yes, we may have some inherent cross-immunity protection, and also our environment. We, right from the early childhood years, we are exposed to so many potent viruses, potent antibodies, compared to the Western, more developed area. So our bodies naturally tend to do well against infection. Again, our environment, open environment. If you go to other areas, built up environment, air conditioned, or because of cold, their environment is always built up areas in enclosed spaces. Ours is relatively very open areas, free movement of air. So all these ones are part of what we believe. And as Dr. Usu rightly said, we need to investigate more. But there is something that is going for us. And once it is going for us, we are not we will encourage whatever is continuing to protect us to do so, and whatever we are doing in that regard, so that we continue on that trajectory. And we are quite happy with that. We need to investigate and see really what the factors are. But something really is going for us.
And I'll come to Dr. Adumaku-Batin to end the conversation. Dr. Adumaku-Batin, any ideas, any clues?
But you know, Ghana Health Service have a very strong structures, Israel.
Right.
A lot of people don't know. If you talk about public health measures, I mean, remember, kindly cast your mind back at the beginning of the pandemic, as Ghana was acclaimed as one of the best countries to manage this very well. Look,
is it because of something we did or something going in our favor and we have no control over?
It's likely. It's likely. But the other thing that I also want to add about it, the deaths. You know, for when people get the disease, the severe forms and critical cases, they are difficult to manage. So even if your cases are going down, the deaths are going to go higher for some time before it comes down.
All right.
So whatever we are seeing, the deaths that we are seeing is not commensurate with the cases. It's because of what happened earlier on.
Okay.
Remember that Delta is able to infect, if you look at the rule, it's able to infect a lot more people. Therefore, a lot susceptible people are infected. So when we get that severe and critical cases, you see, your cases will come down, but the deaths are going to go on for a longer time. But as I agree with Prof and the others, in fact, we have done other studies that we have seen that people are doing something which is more protective. And we still have to look for that. When we did a study in Bono East, we saw that there are other factors that other people are doing that is protecting them from getting the COVID. So we are also trying to look at but something is actually helping and playing on our side. Thank you.
All right. Thank you very much to you, Professor Alfred Yorsing, and to you, Dr. Adomako Boateng, and to you as well, Dr. Michael Owusu of KCCR, for joining us in this conversation. You have a wonderful day to you.
Thank you.
Oh, that sounds like good news.
Well, yeah.
Good news. I'm so happy, especially for Bono East. So happy that the measures they've put in place are paying off. We're happy that we have some vaccines. Happy people are getting vaccinated. Happy that they're not staying at home and too worried about the myths. So good news. My biggest concern though is the length of time that it offers protection for, because it feels like, well, next year by this time we'll be doing the same thing, having the same conversations. But hey, at least we live to fight another day.